Hello everyone, Leo with L&J Duke Till Insurance here. Are you turning 65 soon? If so, then I know that you are being bombarded right now with all sorts of information about Medicare this or Medicare that, or check out this plan and check out that plan, or give us a call or send us an email, and it's probably starting to get a little bit overwhelming. All right, and honestly, all of these flyers and phone calls and emails and everything else really just makes this process and decision more complicated and confusing than it really needs to be. And the last thing that you want is to really quickly rush through this process and pick out a plan just because you want to get it over with, or just because the first person you talked to told you that this is the best plan for you, because it can make it difficult for you in the future if you don't make an informed decision now. So the best thing that you could do is talk to an independent agent. Okay, someone who can answer all your questions and is able to shop all of the available plans and companies to be able to figure out and make sure that you receive the best coverage and the best plan based on your situation. All right, and that's who we are. All right, our services are free, we're unbiased. We like to say that we work for our clients, not the insurance companies. We represent the insurance companies, but we ultimately work for our clients. But we don't charge anything, right? All of our services are completely free, and we just want to make sure that you receive the best plan available for you. All right, and that's also the point of this video, though. Okay, is I wanted to kind of give you guys the basics of what steps you need to take as you begin to navigate the Medicare enrollment process. First, how does Medicare work? Well, there are 4 different parts to Medicare, and for the purpose of this video, I'm not going to explain all of these in detail today. I'm sure we'll have more videos coming out soon that do. But if you have questions, feel free to reach out to us, and we'd be happy to answer any questions you have. But Part A refers to your hospital insurance. Okay, so hospital stays, skilled nursing, home health care, and hospice all fall under Part A. Part B refers to or covers your medical insurance. So that'd be doctor's visits, ambulances, some medical equipment, chiropractic services, lab services, and some preventive services too. Part C is Medicare Advantage, which we'll talk about a little bit more in this video. And then Part D refers to your prescription drug plans, which we also will talk a little bit more about in just a few minutes. All right, so when are you supposed to enroll in Medicare? Well, your coverage begins the first of the month that you turn 65. So you are able to enroll during a 7-month window. Okay, and that starts 3 months before the month that you turn 65 and 3 months after. So for example, if you turn 65 in June, you can enroll in Medicare beginning March 1st. But you can't enroll any later than September 30th during this initial enrollment period. Now, if your birthday falls on the 1st of the month, then your coverage actually starts the month prior. Okay, so again, if your birthday is on June 1st, your coverage actually will begin May 1st, and you can enroll between February 1st and August 31st. Now, if you have worked a combined 40 quarters, okay, so that's 10 years total in your lifetime, then Part A, the hospital coverage, will start automatically for you. All right, if you have already started collecting Social Security, then Part B will also start automatically the first of your birthday month. Okay, so if you are auto-enrolled, you'll actually get your card in the mail about 3 months before the coverage starts. So we encourage you to not delay in enrolling. Okay, if you're not automatically enrolled, go ahead and get enrolled as quickly as you can or as soon as you're able so that you can have this coverage that's available for you the month that you turn 65 and no later than that. All right, so a few notes on Part B. So as I already mentioned, if you've already started collecting Social Security, then you'll be automatically enrolled in Part B of Medicare. Now, there is a premium for Part B, and it's $185 a month, which is usually taken directly out of your Social Security. However, if you or your spouse is still working and you're receiving health insurance through an employer, then you do not have to enroll in Part B. In fact, it may not even make sense to. And that really depends on the coverage that you're receiving through an employer. Okay, sometimes it makes more sense to continue receiving insurance through an employer, either with your employer or your spouse's employer. And sometimes it makes more sense to end that coverage and enroll in Part A and Part B of Medicare. All right, so it really, again, depends on the coverage, okay, that you're currently receiving already. And it also depends on your situation. Okay, sometimes it makes more sense if you and your spouse are both being covered by your employer's insurance, and your spouse may not be 65 yet, so is not eligible for Medicare. Then it might make more sense to remain with your employer's insurance. But again, it kind of depends on your situation. But it is important to note that if you choose not to enroll in Part B and continue to receive health insurance through an employer, then you will have what's called an 8-month special enrollment period where you are able to enroll in Part B once you do retire or your spouse retires, whoever is receiving the insurance. All right, if you do not enroll, however, when you are first eligible, okay, so either when you turn 65 and you're eligible for Part B, or when you retire and you're eligible for Part B, then there is a penalty for every year that you do not enroll in Part B, and it's a 10% penalty that compounds on itself. And once you do enroll in Part B, you'll have to pay that 10%, for as long as you're enrolled in Medicare Part B. So it's really important to get enrolled in Medicare Part B when you are first eligible to avoid these penalties. All right, so let's quickly talk about Part D, which are your prescription drug plans. Now, you should definitely enroll in a Part D prescription drug plan when you first enroll in Medicare. Okay, and that is because if you do not, then you will have a late enrollment penalty similar to Part B. And this penalty is ongoing, and it does increase every month that you do not have a plan. Okay, so even if you do not have any prescriptions, it makes more sense to enroll in a Part D prescription plan when you are first enrolled in Medicare, so that you avoid these penalties later on. Because if you decide not to enroll, but then you have many prescriptions 10 years from now and you first enroll, then you'll have a large penalty that you will continue to pay for as long as you are enrolled in Part D. It never goes away. Okay, in most areas, Part D prescription plans are relatively cheap. In some areas, they're actually even free. So it definitely makes more sense to enroll in a Part D prescription plan and avoid those penalties. All right, and an independent agent can help you find a great Plan D as well. So with Original Medicare, Part A does have a high deductible, and Part B only pays about 80% of your bills. And so many individuals get a Medicare supplement plan in addition to Original Medicare, or sometimes they decide to get a Medicare Advantage plan. Now, Medicare supplement plans supplement, or they fill in the gaps that Original Medicare does not cover. They do have monthly premiums, but they have little to no deductibles or copays depending on the plan that you choose. They're also not limited to a network, so you can get fantastic coverage anywhere in the country, and you get to choose your own doctors. Now, you can set up a Medicare supplement plan 6 months prior to your Medicare start date. So if you are turning 65 in July and your Medicare start date would be July 1st, then you can actually already enroll in a Medicare supplement plan on January 1st of that year. And we have a video about supplement plans that goes much more in depth about these and the individual plans that I will put a link in the description of this video if you want to check that out. Now, Medicare Advantage plans, they are limited to a network of doctors and hospitals, and most of them do have copays and or deductibles that can add up over the course of a year. Now, these may be set up 90 days before your Medicare start date, and you will need your Medicare number to actually set these up. But please note that Medicare Advantage plans are alternative plans to Original Medicare. So by choosing a Medicare Advantage plan, you are actually opting out of Original Medicare when you enroll. Well, I hope that this video has helped answer some of your questions about the Medicare enrollment process. If you do have any more questions, please either email or call or text myself or my brother John. Our contact information is there on the screen, and we would be happy to help. I know that this seems like a complicated process, and sometimes it can be, but we are here to simplify it for you and make sure that we find the right plan for you that best meets your needs. All right, so definitely reach out, and we'd be happy to help. All right, thanks so much.